In the materials and methods sections, the study was carried out retrospectively, observation and cross-sectional study, including 18 and over who present at our tertiary hospital for last 5 years. The set of patients diagnosed with aortic dissection were determined via ICD code, via hospital database system CARMET, and we confirmed the patient's diagnosis by thorac-abdominal CT angiography. Patients with incomplete data were excluded from the study. The mortality status of the patients referred to another hospital for surgical intervention was obtained from the patients themselves or their relatives. What are the variables analyzed in the study? We studied many factors, including patients' mortality rates, especially hospital stay durations and mortality, and the other variables, such as laboratory parameters and demographic data. In the statistical analysis, we made comparison between survival and non-survival groups, and descriptive characteristics of the study are given in numbers and percentages. Quantitative data expressed as mean and standard deviation for normal distributed data and median for non-normally distributed data. For normality test, we use Shapiro-Wilk test because of n lower 50. Independent t-test was used to compare the means between the two groups. And also correlation analysis was made. All analysis was performed in 90% confidence interval, and statistical significance was defined as a p-value less than 0.05. In our study results, the retrospective analysis include 32 individuals diagnosed with aortic dissection in our emergency medicine, with 24 of them being male. 81% of patients were diagnosed with type A dissection, and also surgical intervention was also performed in 81%. The mean age of patients was greater than 65. The median length of hospitalization was 4 days, and also in hospital mortality rate was 25%. Furthermore, the descriptive characteristics of all patients and between groups are summarized in Table 1. We look at the table. We compared the patients and diagnosed with aortic dissection in survival and died patients. We saw there was no statistical differences between the survival and non-survival groups in terms of age,